Thank you very much, and good afternoon, everyone. Over a year or so, after over a year of so much personal and economic pain brought on by COVID-19, we're hopefully on our way to bringing back everything we love about our city. But to make that happen, we need every Philadelphian to get the COVID-19 vaccine. Now, everyone over the age of 16 is eligible to get vaccinated. It works, it's free, and you don't need insurance, and it's safe. And it's easier than it has ever been to get vaccinated in Philadelphia. So this week, if you haven't done it yet, I ask you to do two things. First, come on down to the convention center or any other vaccination site in the city and get your vaccine. Second, when you do, bring your parents, grandparents, or other loved ones if they aren't vaccinated yet. They may need a little help to the clinic, but if you help them get there, you may just be saving their lives. You can make appointments, or now at the convention center, the site at Esperanza, and many other sites, you can just walk in without an appointment with little or no waiting. So please vax up, bring your loved ones, and then let's get back to enjoying the celebrations, the family gatherings, the religious services, and everything else we've missed. To find out how and where to get the vaccine, please visit phila.gov/COVID or call 311. That's phila.gov/COVID or call 311. And now Dr. Farley for the update.
Thank you very much, Mayor. The news is mixed today. The epidemic is still at very high levels, but as the Mayor said, the vaccination is more available now than it's ever been. Here are the numbers. Since this time yesterday, we've identified 747 new cases of the COVID infection by the PCR test or the antigen test combined. For the past week, by the date in which the sample was collected, that's the 11th through the 17th, we averaged 586 cases per day. So far, we expect more with late reporting. And of those people tested, 7.3% tested positive. That's likely means we'll end up with a higher number than the week before, when we averaged 591 cases per day and 7.6% of the people tested positive. That's what's happening in the community. In hospitals now, the number of hospitalized patients is continuing to rise. Today it was 551. That's compared to a week ago where we were 504. Similarly, the number of people dying from this infection is continuing to rise. We have 13 new deaths identified, bringing us to a total of 3,395 since the beginning of the epidemic. Now, we hit a low of 23 deaths in a week as of the week of March 21st. But the week of April 4th, we were at 44. And unfortunately, we're likely to see more increases in deaths in the coming weeks, because the way this works is you see first increase in cases, then increases in hospitalizations, then increases in deaths. So we do expect the number of deaths per week to rise to more than 50 per week soon. Now let me move on to vaccination. As the Mayor said, there's good news here. Vaccination now more available than ever. Everyone over the age of 16 is eligible. And we're doing something special this week. We're calling this week, Bring Your Loved Ones to Get Vaccinated Week. We want to encourage young people to bring their older parents, grandparents, or relatives to vaccination sites, get everyone vaccinated together. The older people may need help in getting to those clinics. The younger people can help them get there, get vaccinated, and get back home. And if you do that as a younger person, you just may save the lives of your elderly relatives or friends. So how is vaccine being made available today? Where can people get vaccinated? We're now up to 274 sites that are enrolled as vaccine providers and receiving vaccine. That number is up 13 since last week. That includes hospitals and clinics and pharmacies. We're now up to 49 independent pharmacies that are enrolled as vaccine providers. That's more than three more than where we were last week. Overall, our vaccinations are now happening more quickly than ever. For the week of April 11th, there were 124,000 doses administered across all providers across the entire city. Now, for the most recent week, the week that ended April 18th, it's 95,000 so far. Now, we do expect that number to increase, but still, it's a lower number than the week before, and is a sign that the demand is easing off, which means that there are these available slots for people to be vaccinated. Now, overall, as of Monday evening, yesterday, there were 680,000 people from Philadelphia who had at least one dose of vaccine and 451,000 who were fully vaccinated. If you look at the data tracked by the Centers for Disease Control, which has data on Philadelphia residents who are vaccinated outside the city, and now 51% of the people over the age of 65 were fully vaccinated. It's good for that 51%, but we still need to boost that numbers in order to protect the people over 65, who are the ones who are most likely to die. That's why we need the younger people to bring their loved ones in for vaccination. Let me talk a little bit more about the sites that we are operating or we're operating with others. The convention center first. This center is now using the Pfizer vaccine and they're delivering first doses. The center vaccinated about 4,500 people each day, Saturday and Sunday, and about 3,500 people yesterday. There are open slots now. People can walk in with no appointment and there's no waiting. It's any person who lives or works in Philadelphia is eligible there. Now, if people want an appointment, appointments are also available. The clinic is open from 8 a.m. to 6 p.m. for appointments, or if people want to walk in, you should walk in between 8 a.m. and 5 p.m. Then there's the federally supported type 2 vaccination site at Esperanza and Hunting Park. That site also changed to the Pfizer vaccine last week. That site is now open 5 days per week, Monday through Wednesday, and Saturday and Sunday. The hours change day to day. On Monday and Tuesday, it's open 7 to 3. On Wednesday, it's 12 to 8. And then Saturday, Sunday, 9 to 5. And this site vaccinated about 1,000 people each on Saturday and Sunday, and about 450 people yesterday. We are stepping up our outreach to the surrounding neighborhood around that site, and walk-ins there are accepted and encouraged as well. One other step we're making it easier for people to get vaccinated is, as of today, you can schedule yourself at one of these sites on our website. Go to www.philadelphia.gov/COVID. There's a banner at the top. You can click on that. It'll take you directly to our scheduling software. So you can go in there and see where the slots are, and you can put in your name to actually schedule yourself at the convention center or at Esperanza. The dates available now on that scheduling link are Wednesday through Friday this week, and later we'll post weekends and beyond. Now, in addition to those sites, there are neighborhood clinics that are being operated by the health department. Today, we're at Community Academy in Juniata Park. Tomorrow, we're at Gathers Rec Center at 2501 West Diamond Street in North Philly. On Thursday, we're at the University of the Sciences at 730 South 43rd Street in West Philly. And on Friday, we're at the Guerin Rec Center at 2201 South 16th Street in South Philly. And there's a calendar that is posted on our blog on the website for all these future neighborhood clinics. Now, in addition to that, we have additional vaccine providers that will be funded under our request for proposals to announce today. There are 4 additional providers. We announced initially there's 7 before, now there's 4 more. These are Congreso de Latinos Unidos, Puentes de Salud, City Life Health, and Penn Medicine. So all of them will be increasing their access to vaccination at different spots across the city. Let me talk a little bit about the outreach efforts. As the vaccination slots are opening up, it's more important for us to be doing outreach and encouraging people to come in to be vaccinated. So we are doing phone calling now to anybody who's in our vaccine interest database to talk to them about the different slots and the opportunities that are available. There's also phone banking in low vaccinated zip codes where we're just calling people who live in those areas. The city's health plans, just virtually every health plan in the city is also calling their own members, whether we're talking about Medicaid, managed care, or other health plans. We're calling our own members and talking to them, helping them get scheduled in our vaccine clinics. And we have staff going to high traffic neighborhood sites, particularly around Esperanza. We're scheduling people and giving them transit passes to go to the different vaccination sites. And we have staff that are canvassing in the neighborhoods around Esperanza. In addition to that, we're doing a variety of social media messaging to encourage people and inform people about where they can go to get vaccinated. So if you want to be vaccinated now, what should you do? The first thing you should do is think about what relatives or friends over the age of 65 you can bring with you. Then go to our website, www.phila.gov/COVID, to schedule an appointment, or just walk in at the Convention Center or Esperanza. In addition to that, there are pharmacies and hospitals and clinics that have their own online signups. We are encouraging the pharmacies, which are mainly using online pre-registration right now, encouraging them to accept walk-ins. And in the future, I hope you'll hear more and more of the pharmacies allowing people to just walk in for vaccination. And soon we'll post a map of all these different vaccination providers so people can get a sense of what providers are in their neighborhood. Now let me turn to preventing exposure in the epidemic. Just remind people that despite all the good news about vaccination, the COVID-19 epidemic is still here and it's still deadly. Our case rates are rising. They're now at the highest level they've been since the first week of 2021. And we had that post-Christmas and post-New Year's holiday surge. Our hospitalizations are rising and our deaths are rising. The reasons is that people are increasingly out and around, getting together with others, dropping their guard, not wearing masks, and we are seeing variants representing an increasing fraction of the viruses that are circulating. These variant viruses are prevented by vaccination, but they are more infectious. They're more likely to spread from one person to the other than the version of the virus that was circulating a few months ago or even a few weeks ago. So I've been asked about whether we will back off on the restrictions we have in place on April 30th. Just to recall, restaurants right now are kept at 25% of maximum occupancy for their indoor dining and 50% if they meet our enhanced ventilation standards. And we also have a prohibition on indoor catered social events. In light of these still rising case rates, we will not be making any decision to relax these restrictions now. We already have too many unnecessary deaths. We don't need any more. We don't want to become like Michigan. So we'll watch our case counts, and we'll talk about this more at our press conference next Tuesday. So what should people do in the meantime? Well, please wear a mask, keep your distance, and avoid being around others, and bring your loved ones to get vaccinated in the meantime. All this information is at our website, www.phila.gov/COVID. Thanks.
Questions for Dr. Farley. I'm just following up with you about last week. You mentioned that the health department received complaints with photos about fans at Citizens Bank Park not wearing masks. Can you give us an update where things stood on that?
We've communicated with the Phillies, and they said that they're going to be diligent about enforcing mask use, and that's where it stands.
Okay, I've been to a couple games, and I see during every stoppage of play, the ushers walk down the stairs of the stands with a sign that clearly says "mask up," and I think they're doing a good job.
And final one for me, for both you guys, is Dr. Farley, you mentioned about the case rate in Philadelphia is rising right now. Have there been any discussions about decreasing the amount of fans inside Citizens Bank Park and the Wells Fargo Center?
We haven't had serious discussions about decreasing that, but we're not going to be increasing it right now either.
All right, thank you.
Thank you, David. We will now go with Kelly Rule at Fox 29.
Dr. Farley, are you seeing more cases among the younger population? And if so, how much do you think vaccine hesitancy is contributing to that?
The increase we've seen in the past few weeks is more amongst younger people, by younger people, say, 20 to 45 than it is among older people. And so some of that reduced, maybe we try to vaccinate more of the older people. And so I would hope that we would see less of an increase in the older folks, and the younger folks, we hope will handle the infection better. So I'm not sure there's so much vaccine hesitancy as it wasn't necessarily that they were not necessarily eligible in the past. But now that it's open to everybody, we certainly want all the younger people to be vaccinated as well.
And just staying on that topic of, vaccine hesitancy, is that something you feel that you're seeing at all? I know you mentioned demand is easing off a bit, but obviously there are, more appointments available now than there were before.
We are concerned about that. We know that from surveys, there's a small fraction, maybe 10 or 15% of people who say they don't want the vaccine at all. But there's a large fraction of people who are willing maybe to get vaccinated. You might call them wait and see people. And I'm hoping we can get all those folks vaccinated. And if we do, then we still would have a high percentage of people vaccinated. It may take us some time to get through those, though.
Thank you.
Thank you, Kelly. We will now go with Maggie Kent at 6 ABC.
Thank you for taking my question. I understand that there are less people showing up to the FEMA sites, less people showing up to, or making appointments, I should say, at the city-run sites as well. And I was at the Leah Core Center today, and there were very few people there. What is a possibility, or what are the conversations now surrounding what do we do with this vaccine supply? And is there any conversation being had right now about expanding it to people who live in the collar counties to come to a FEMA site or something like that?
Yeah, we're in a different posture now where the limiting factor is going to be less how much vaccine we have available and more just how many people want to come in and be vaccinated and how easy we can make it for them. So we're now trying to make vaccine as easily available as possible to those people and do as much outreach to people to encourage them to come in. As I said, encourage them to come in groups and bring in their elderly relatives, so that maybe that's one way of getting folks in. Right now, we are at our sites, as far as your second question, it's eligible for people who live in Philadelphia or who work in Philadelphia. At some point in the future, if we feel like we've really adequately tapped those folks out and we're having slots go unfilled, then we may consider folks outside of Philadelphia. But remember now, this pattern is happening across the country. And so people can get vaccinated in the suburbs as well. It's easier than to get vaccinated than ever, really everywhere.
Just to follow up, are you now thinking about the next wave of vaccinations, which would be children 12 to 15, if that's approved by the CDC, and the possibility of these booster shots that we were talking about? And I guess incorporated with that, what does success really look like? And are we getting there, since we have 38% of people in Philly with their first dose and 25% with both? When do we call it a success?
Yeah, so we are thinking about how would we vaccinate children down to 12 and later on maybe all the way down to 6 months. And what about booster doses, which may be encouraged as early as the fall or the winter. And so while we're working very hard on what's happening today, we're also planning a little farther out. As far as success, I would measure our success. Are we vaccinating enough people to where either the virus is circulating at very low levels, we have very few cases, or at least have very few deaths? It may be that we can vaccinate to the point where nobody's dying, but we still have cases out there. That's still a success. Whether we'll get there, we don't know. We really need to have people get vaccinated. And how much we can reach those people who are not vaccinated yet is still an open question. And that's not just for us in Philadelphia, but that's across the entire nation.
Thank you.
Thank you, Maggie. We will now go with Jack Thompson at Metro.
Thank you. For Dr. Farley, just to be clear about the COVID restrictions, there will be no easing on April 30th. Is that what you're saying today?
We're not announcing any easing now. That we'll discuss that again next week.
Oh, okay. And so what is supposed to happen, I guess, at the end of the month, or what restrictions are expiring?
When we put the restrictions in place, we said, or the most recent change, the change was written with an expiration date of April 30th. We said that we would ease back on the restrictions if case rates were falling. And they're not falling, so we're not easing back on restrictions, or at least we're not announcing that today. If we get to that point, then how far we might ease back of them would really depend on what's happening with the epidemic and where we think it's being spread.
And one follow-up about the demand question. I mean, do you think we will reach a point at some point in the next couple of months where there's, everybody who wants to or is willing to get vaccinated has been vaccinated, and there's just a core group who's just not, is against vaccination?
There will come some point where we will vaccinate everybody who wants to, and there'll be some people left who are unvaccinated. But that point may be a long time from now. It may be months where we're vaccinating a relatively small number of people per day, but we're continuing to vaccinate some, and there's benefit to that. So it's a different phase, but nonetheless a very important phase. We'll never get to 100%, but the higher the percent we get to, the better.
Thank you.
Thank you, Jack. We will now go with Alan Yu at WHYY.
Hi, thank you. My question is also for Dr. Farley. I'm wondering if you can talk a little bit more about the capacity for either the city or partners at the CDC or state for sequencing COVID-19 variants from the positive cases. Do we have an idea as to how many of the positive cases are being sequenced? And do we know, for example, what lineages are responsible for the cases in the city?
So we do have data on the sequencing that is being done. It is a small number of laboratories in the city that do it. It's a relatively small fraction of the total cases per day. We have hundreds of cases per day, so it's just a fraction of those. We can get you the exact numbers, but it's nowhere near every virus. We'll never know that. And what's useful is just the overall trends. Is it increasing? And do we think that the percentage of those that are sequenced that represent variants is increasing? And both of those is the percent high. Both those are pointing in the direction of variants being more important. We're seeing more of them reported each week. And to the extent we have laboratories that give us the numerator and denominator, the percentage is quite high. The most common variant is the B117 variant that was first recognized in the United Kingdom. That is one that responds well to the vaccine. And so it is more infectious, but we do think that we're on the right strategy for preventing it. But people should expect that the variants are very common here. You might view it as no longer variants. Just the virus is new and improved compared to what it was 6 months ago.
That's it. Thank you.
Thank you, Alan. We will now go with Johan Calhoun at Chalkbeat.
Yes, this question is for Dr. Farley. Case rates in Philly are rising. How are numbers for school-aged juveniles, specifically Black and Latino youth?
I don't have the number for you, but we can follow up with that number.
Okay, and I believe all teachers who signed up to get vaccinated have received their shots. Is that correct?
I can't give you that, be certain, because that there are always people who initially decide that they don't want to be vaccinated and they later change their mind. I can tell you that the CHOP initiative to offer vaccine to teachers is finished. They vaccinated everybody that they invited. I can tell you that we set up other opportunities for teachers and childcare workers to be vaccinated, and many of them have taken that opportunity, and there's lots of opportunity elsewhere. So, I think that every teacher who is certain that he or she wants to be vaccinated has had that opportunity by now.
Okay, it looks like we're going into summer school session, and hopefully all schools, all grades will return in the fall. So in regards to cautionary measures moving forward, what kind of advice are you giving to teachers and for students who are planning to go back to school?
The recommendations that we would give are the same recommendations that the CDC gives. There's recommendations about density, and which vary at whether it's elementary level or high school level, and improve ventilation, hand washing, that sort of thing. So that I don't think that's going to change. We hope that the case rates are going to be far lower, and we hope that most people, teachers and staff, are vaccinated by then. And by the fall, there may be a large fraction of children who are vaccinated.
Thank you.
Thank you. We'll now go with Laura McChrystal with the Inquirer.
Hi, Dr. Farley, is there a set percentage of the Philadelphia population that you are aiming to vaccinate in order to return to normal? I know that the 70% number gets thrown around a lot as kind of a potential herd immunity number, but do you have a firm idea at this point?
I don't. We simply want it to be as high as possible. That people, you hear people talk about herd immunity as if it's either you have it or you don't, and it doesn't work that way. It's just in general, the higher the percentage of people vaccinated, the more the unvaccinated people are protected. So we will learn, and the rest of the nation will learn how many people are willing to be vaccinated. I just simply want it to be as high as possible. It will take us some number of months to get there, though, because the most eager people at this point have been vaccinated. Now we're getting the people who are less eager or more ambivalent, and that's going to take longer to reach them.
Okay. It sounds from the numbers that you gave for, the FEMA site, for example, that through the weekend, it sort of remained that they were giving not as many doses as they have the capacity for. Is it fair to say then that the opening up to everyone didn't amount to an immediate new rush to get vaccinated?
That's right.
Okay, and is that concerning?
Yeah, we are concerned that there are still people unvaccinated, and that's why we're making it as easy as possible to be vaccinated and doing more outreach to encourage people to come in.
Okay, and lastly, I know there's been some discussion elsewhere in the country about lifting certain restrictions that people are sort of saying the science doesn't necessarily back up that it plays a huge difference, such as like an outdoor mask mandate. Is that something that you're considering in Philly, or would you rather have everyone wear their mask all the time still?
I'm not sure. I don't know that our mandate does require mask use outdoors unless you're close to someone. If you're still within a few feet of someone, I would recommend it even outdoors. But if you're outdoors separated from people, you don't need to wear a mask.
Okay, thank you.
Thank you, Laura. We will now go with David Morrell from Philadelphia Magazine, and then we will open for a second round of questions. David?
Hi, yeah, a question for Dr. Farley, actually sort of along the lines of what Laura was just asking about. I'm just curious, particularly, as she was alluding to, it sounds like most transmission is, coming from sort of airborne aerosols, which are least risky when outdoors. I'm just curious if you think if there's more room for nuance on the mask guidance, particularly as it relates to outdoor, in public use among people who are fully vaccinated, and if you think it makes sense to have different sets of guidelines based on where people are in their vaccination, progression or status or not, or if the blanket, across the board still wear it in public is the most prudent approach.
If you want people to follow rules, it's really important that they be as simple as possible and clear as possible. And so more complicated rules about, well, you can wear it if you're this sort of person, but not if you're that sort of person, that tends to erode the social norm, the expectation that people are wearing masks. And so I would not be a big fan of making it too complicated when mask use is so important and so simple and really not that inconvenient.
Mayor Kenny, did you have anything you want? I was curious just what your opinion was.
Why is wearing a mask so difficult? I'm still fascinated by the mindset and the whole argument. And I think it started back in the last presidential administration that gave people some kind of out that there was somehow tyranny or the like. And it's such a shame because so many people died as a result of that. And I'll go back again. I've said it more than once, and I'll say it again. During World War II, we were disciplined. We went to war. We went to factories, and women left the home and built planes and tanks. People were united and together, and we won. And wearing a mask isn't even close to jumping out of an airplane with a parachute on the beaches into Normandy. So I still will never understand why this is such a hard thing.
Just one final thing, I guess for Dr. Farley or Mayor Kent, if you wish to add something to it. But now that we're approaching a point where we're sort of reaching the people people who are to be vaccinated who might need, convincing or carrots, if you will, to sort of convince them. I mean, I wonder will you be trying to think of restrictions that you might be lifting for fully vaccinated people to sort of entice that person who might be, eager to not wear a mask in public or eager to do some type of activity, as a sort of means of, providing them an extra benefit beyond their own health, to get vaccinated, if you're thinking of restrictions in that way at all.
Yeah, the problem with restrictions that vary according to whether you're vaccinated or not is then people need to prove whether they're vaccinated or not. And right now, if you're vaccinated, you get a card that is very easy to forge. And so I think that would just create a brisk business in people creating fake vaccination cards. And creating one that is really something that can't be forged or can't be faked is a huge enterprise. And I'm not really sure that it makes it, by the time we get it in place, that it would be accurate, because by then the value of the vaccine may have worn off. So I'm not a supporter of that.
Okay, thanks.
Thank you, David. We will now start our second round of questions with Argenis Figueroa from Univision 65.
Hello, ¿me escuchan?
Yes, we can hear you.
Okay. Voy a necesitar, Armando, tu ayuda, por favor. Gracias. Mi pregunta es para el alcalde sobre los preparativos que tendría la ciudad en la espera del veredicto del exoficial de policía. Quería saber si la Guardia Nacional está ya efectivamente en Filadelfia, dado que el gobernador autorizó su movilización este fin de semana, y si la alcaldía de Filadelfia tiene contemplado un toque de queda para mayor seguridad.
The question is for the mayor. Mayor, the question is, what preparations is the city having in awaiting the verdict on the trial of the former police officer in Minneapolis? And now that the governor has allowed the National Guard to be deployed, are they already in Philadelphia? And is the mayor's office contemplating any sort of curfew for the city?
Well, the National Guard has been deployed. They are not particularly in view at the moment. Police have a robust plan for responding to any type of vandalism, looting. We expect people, regardless of the outcome of the trial, to express their First Amendment rights, and we want them to do that safely and peacefully, and we'll be prepared to assist in that. Also have dealt with, through our Commerce Department, our business strips, and our business community, working with them, trying to coordinate their needs. We've also been talking to people, our folks in behavioral health, to deal with the communities that are going through reliving the George Floyd killing again and are upset and affected by that. We are working with our clergy community, our religious community, to have places for people to express their concerns and views and to pray, and trying to approach this in a holistic way, not just law enforcement related, but every aspect of how this event almost a year ago has affected everyone, people of color especially, and we'll get the right verdict, and we can deal with this and go forward.
Efectivamente, la Guardia Nacional ha sido ya programada en la ciudad, pero no está a la vista de la gente en gran mayoría. Tenemos un robusto plan para poder enfrentar cualquier acto de disturbios civiles o de vandalismo que pueda haber, o de saqueos, y sin importar el resultado de que sea el veredicto, la gente tiene el derecho de expresarse en la protección que les ofrece la primera enmienda constitucional, de juntarse pacíficamente, y nosotros vamos a ayudarles a que eso así suceda. Pero también tenemos el apoyo de muchas otras instituciones y estamentos, como la comunidad comercial. Nosotros tenemos a nuestro Departamento de Comercio que está coordinando las necesidades de los propietarios de pequeños negocios. También nosotros estamos trabajando con la salud conductual, la salud mental de la gente, que se va a ver afectada, obviamente, en el recordatorio de la muerte del señor Floyd Kelly. Y también estamos trabajando con nuestros clérigos y la comunidad religiosa para tratar de que la gente pueda tener un lugar en el cual conversar, discutir, expresar sus sentimientos y, por supuesto, orar por lo que vaya a suceder. Y nosotros no estamos solamente apoyándonos en las agencias del orden, estamos teniendo una respuesta global, teniendo en cuenta que va a haber un efecto cuando se dé este veredicto que pueda afectar principalmente a las comunidades de color. Por lo tanto, estamos haciendo un esfuerzo multisectorial para anticipar cualquier resultado de este veredicto. Muchas gracias.
Okay. Gracias a ustedes. Es todo. Thank you so much.
Gracias, Argenis.
Okay, a ustedes.
We will now go with Jack Thompson with Metro.
Yes, just one follow-up question. I may have missed this, but Dr. Farley, can you provide the city's allocation of vaccines for this week?
I don't have the exact numbers, but we're getting about 40,000 doses of the Pfizer Moderna first and second, so combined about 80,000. So about the same that we were getting before. And we've been told by the federal government that it should be about flat for the next few weeks.
Okay, and there's extra doses coming for the convention center site, or that didn't start yet?
There are additional doses coming for the convention center. That's right. As well, there are doses that the federal government gives directly to chain pharmacies that are not counted in that number.
Okay, thank you.
Thank you. We will now go with Manny Smith from CBS 3.
Hi, good afternoon. Question for the mayor or Tumar. Just asking if there's an estimated cost of security preparations insofar the National Guard being here and the extra police deployments.
Tumar, if you know, I'm not aware of the estimate.
Yeah, we don't. Hey, Manny, we don't have a specific estimate yet. But just thinking back through last summer and then looking at what we would have to spend up for this particular event, we expect it to be expensive, but we don't have any estimates just yet.
This wouldn't be like a reimbursable cost from the feds potentially, would it? Or?
Not necessarily, but the National Guard with the declaration, I think, of disaster declaration from the governor, some of those costs are supported there. But this is cost that's primarily have to be dealt with on a city budget level.
All right. And then the last thing was, I know during the last set of unrest, there was some reports of officials or police agencies on our collar counties not necessarily being helpful to Philadelphia's efforts. Are there conversations about coordination or safety, especially around the retail districts where we can partner with the outside counties on that?
Yeah, we have.
Good. Good.
Yeah, we have mutual aid requests then, and we've been talking with all of our partners. And I wouldn't necessarily couch it as they didn't want to be helpful. I think what they started seeing, folks that came into Philadelphia to help support our operation, and they started seeing some activities within their own counties, and then they had to go back to deal with that. So, but there are certainly conversations we've been having with all of our mutual aid partners.
And we're getting great cooperation from our state police the last time and this time.
Thanks, everybody.
Thank you.
Joy, you need to unmute.
Mike?
Yeah, I think Joy might be having some problems. Let's go to Laura McChrystal of the Inquirer.
Hi. Dr. Farley, you had mentioned the RFP and the groups that have gotten those awards. Can you tell me, are any of those contracts in place already, or are they still being negotiated?
Yeah, their contracts are still being negotiated. However, a number of these providers have been vaccinating, and so that they'll end up be retroactive. So that's not limiting the vaccination work of the providers.
Okay, retroactive meaning they can essentially a reimbursement for work they've already been doing?
Yes.
Okay, and then a follow-up to that is, are these providers all already existing providers, or are there cases in which this money is helping them to actually expand what they're doing or become a provider in the first place?
Well, they're all healthcare providers, but not all of them were vaccinating before the request for proposals. Each one's a little bit different.
Okay, thank you.
Thank you, Laura. We'll now go with Maggie Kent at 6 ABC.
Thank you. So I wanted to follow up with Mayor Kenny in terms of the protests and the possible preparations for any rioting and looting that may happen. And we don't know the exact cost estimates right now, but I've been talking to some people who are saying, this militarizes our neighborhoods. This is not something that is necessarily welcome by people who live in these neighborhoods, and they feel as though the presence may actually encourage more escalation than a de-escalation. What would you say to that?
The role of the Guard is to guard fixed assets of the city and to be on station at large shopping strip malls that experienced a lot of looting the last time. Philadelphia Police will be enforcing the law. The National Guard will not be enforcing the law, and the National Guard will have Philadelphia Police with them on a dual assignment together. But that their presence frees up our police to be able to respond rapidly to calls for help on business strips and on shopping malls. And last time it took a little while for the Guard to get here. Once they got here, things began to calm down because the police were more agile and mobile and able to get to places where we were asking for assistance. This is it's a difficult time for cities across the country. And the Guard, I have found, are very they're young, they're smart, they're well prepared. They're polite. They interact with people in a positive way, and they're not doing law enforcement. So it's just extra hands on deck for us to keep things calm.
I also understand that the disaster declaration is for 90 days. So we're looking at, I guess, let's say 87, 86 days from now. And would you expect that to expire quicker? Would you hope that it would expire quicker?
I hope it doesn't happen at all. I hope that we don't have any problems. I hope that the verdict is fair, and I've watched that almost entire trial almost daily, and I know how I would vote how I would rule if I were a juror in that trial. But I will tell you that we don't want anything to happen, and we want to be as prepared as possible. So it's not only just a law enforcement response. As I talked earlier, there's a response when it comes to our commerce response, when it comes to our religious response, when it comes to our mental health response. There's a multifaceted way in which we're preparing for this, and we want to make sure we cover all bases.
Thank you.
Okay.
Thank you, Maggie. And thanks to all our participants. That concludes our weekly briefing on COVID-19. Dr. Farley will hold a press conference on Friday, and the mayor and Tomar will join us again next Tuesday. Thank you.